What is a POS plan? Have you ever wondered how health insurance plans can offer both structure and flexibility? Today, we will talk about a specific type of health insurance plan known as a point-of-service plan. This plan combines features from health maintenance organizations and preferred provider organizations, making it unique in the healthcare landscape. At the heart of a point-of-service plan is the requirement for members to choose a primary care physician from a network of providers. This primary care physician acts as a gatekeeper for your healthcare needs. They coordinate your overall care and provide referrals to specialists when necessary. If you want to see a specialist, you typically need a referral from your primary care physician, whether that specialist is in network or out of network. Now let's break down how you can receive care through a point-of-service plan. First, there is in-network care. When you visit doctors, clinics, or hospitals within the network, you enjoy lower out-of-pocket costs. Your insurance usually covers a larger portion of the expenses, and your primary care physician helps manage the paperwork and billing. This makes the process smoother for you. On the other hand, you also have the option for out-of-network care. While you can choose to see providers outside the network, this usually comes with higher costs. You may face increased co-payments or co-insurance, and you might need to handle your own paperwork to get reimbursed. This can add some complexity to your healthcare experience. When comparing point-of-service plans to preferred provider organization plans, you will find that point-of-service plans generally have lower premiums. However, they requiring more involvement from you in managing referrals and paperwork, especially for out-of-network services. Unlike health maintenance organizations, which typically do not cover out-of-network services except in emergencies, point-of-service plans do provide some coverage for out-of-network care, though at a higher cost. From a sociological viewpoint, point-of-service plans illustrate how healthcare systems balance cost control, access, and patient autonomy. The role of the primary care physician as a gatekeeper aligns with efforts to coordinate care and manage resources effectively. However, the ability to seek out-of-network care introduces an element of consumer choice and flexibility. This can impact how often patients utilize healthcare services and their overall access to care. In the context of health insurance exchanges and broader healthcare systems, point-of-service plans representing a middle ground. They show how insurance design can influence patient behavior and healthcare provider networks. This, in turn, affects health outcomes by shaping who patients see, how often they visit, and the costs involved. If you are considering a point-of-service plan, think about your preferences for flexibility versus cost. Consider how comfortable you are navigating referral systems and whether you need access to providers both within and outside a network. Point-of-service plans can be a good fit for those who want a balance between coordinated care and the option to seek care beyond a limited provider network.